From the PEP Radio Newsroom, this is part one of a two-part story from The Advocate about gender-affirming healthcare and one very large healthcare entity in Ohio. As part of a settlement with the U.S. Department of Justice, the Cleveland Clinic pledged $2 million in care for people who detransition after receiving medical interventions as minors. The clinic said not much is changing because it already provides that care, but transgender advocates say the settlement with such a high-profile institution lends credibility to a politically charged effort to roll back transgender healthcare across the country. The settlement followed a 2025 investigation into the hospital system over allegations it falsely billed insurance for what the Department of Justice called sex-rejecting procedures on minors, which the agreement defined as providing puberty blockers, hormone therapies, surgical interventions, or voice modification interventions. This type of healthcare is more commonly known as gender-affirming care. That's an umbrella term for the treatment of gender dysphoria, or the discomfort that comes when someone's gender identity differs from the sex they were assigned at birth. The clinic is jumping to the front of the line to comply, not with science and medicine, but with cruelty and anti-trans hate, said Dara Atkinson, executive director of Trans Ohio. The hospital is the second in the country to settle a dispute with the federal government by providing detransition care in the last month. Under the agreement, the hospital also agreed to pay $308,000 to resolve the billing allegations. The dollars will go to both the federal government and the state of Ohio, whose attorney general is a party in the settlement. Additionally, the Cleveland Clinic committed to not perform or offer medical interventions associated with gender-affirming care to minors for 2 decades at its hospitals across Ohio, Florida, Nevada, Canada, the United Arab Emirates, and the United Kingdom. By committing dollars to detransition care, the Cleveland Clinic is hoping to provide essential medical care for individuals living with the harmful consequences of such misguided medical interventions performed on them as children and adolescents, a press release from the Department of Justice stated. The hospital system largely downplayed the settlement. The Cleveland Clinic and all hospitals in Ohio are already banned from providing gender-affirming care to minors under state law. And a clinic spokesperson wrote in response to questions that the hospital has always offered services to patients wanting to detransition, and that the settlement simply indicates a commitment to continuing to do so. We are pleased to have worked collaboratively toward a resolution related to an unintentional coding issue involving a small number of patients, wrote Angela Kiska, the executive director of public and media relations for the Cleveland Clinic, in a statement. We remain focused on providing exceptional care to our patients and communities. The Cleveland Clinic does provide gender-affirming care to adults, which will not change under the settlement, a hospital spokesperson wrote in an email. A copy of the settlement was provided to Signal Cleveland and the Buckeye Flame by the Ohio Attorney General's office. It alleges that the Cleveland Clinic knowingly submitted claims to Ohio Medicaid with false diagnosis codes in order to obscure the true reasons the patients were treated for gender dysphoria. In the settlement, the clinic denied those allegations. We'll have part 2 of this story this evening between 10 p.m. and midnight. PEP Radio is available on the Live 365 app, the PEP Radio page at paequality.com, Roku, Alexa, and wherever you find streaming radio. Up next, we have the Meadville area weather forecast here on PEP Radio.